Gentlemen, you are both drunk on cosmic wine.
Welcome to the show. I'm Dr. Mark Sylvester.
And I'm Dr. Richard Schulman. This is Alt Psych.
Welcome, everybody, to another episode of the Alt Psych Show. Today, we got a special guest. We're going to talk about manipulating and the mind. And by that, I mean our special guest is the famous chiropractor, Dr. Jeffrey Kaplan of the Advanced Chiropractic and Physiotherapy Center in Lakewood Ranch, Florida, 34202.com. Welcome.
Thank you. It's my pleasure being here.
Yeah, thanks for joining us on a rainy Friday afternoon. Rich, what do you think? We have a chiropractor on this show today talking about mental health.
Well, yeah, I don't know. Why don't we ask him?
Okay.
Hi, Jeff.
Why are you here? How did you get in? Who let you in?
Seriously, anytime a body therapist touches the body, touch is going to evoke emotion. And if he's working with the spine, he's working with the central nervous system. So that may have something to do with the mind and emotion. So how you doing today, Jeff, now that we've gotten over the jocularity part of the show?
Doing great, man. Having a great Friday so far, so good. Done with my patient care for the day, and looking forward to communicating with you guys. Getting the word out about what we do and how we can get people working better and get their bodies healthier.
How did you come to being a chiropractor? How did you make that life decision?
What are your credentials? Do you actually have credentials? Can we see them?
I have credentials. I had to go to school for 8 years, 4 years undergrad, biology major, and then 4 years of chiropractic school, and then a bunch of tests, all national board exams and state board exams and so on and so forth. And once you finally get through all that, you could actually now provide care to people that walk in through your front door. And
did you have experience as a kid, like going to chiropractors, or was it in your family?
I did, actually. I did. Growing up on Eastern Long Island, one of my neighbors, he was a chiropractic physician, and his son was my age, and his daughter was my brother's age, and we lived in a cul-de-sac, and we all played sports. And anytime there was some type of injury from playing soccer 3 years old all the way up through college, we were always brought over to see the chiropractor for any type of dysfunction that went on with the body. And that's how I was first like, whoa, I'm not having to go get some type of injection or some type of pill, and my body's working better after, this guy laying his hands on me. And from there on, I was like, I want to do what he does, and
so basically what you're saying is you've been brainwashed since the beginning.
Yeah, I was more like body washed, not brainwashed. I didn't have to understand it. I just knew that my body was working better when he washed away the cause of the problem, and now my body could express itself more efficiently, ultimately feeling better and working better.
And we've talked about that. I had a very different experience. I used to not only not believe in chiropractic. I was raised by an allopathic physician, and my stepfather kind of taught me it was devil's work. And, I want to believe, I think my whole life I've always wanted to believe, to the point where I tried several chiropractors over the years, and I just never really saw results. And I kind of reaffirmed that, like, where's the science in here? Where's the magic? And the reason, one of many reasons why you're on the shows, but one of my earliest recollections is that I got results with you, and very quickly, and most importantly, you got me to believe in the field, and kind of started, this was many years ago now, but it shows that I kind of came full circle, because I think some people out there either don't understand the science, they don't believe in it, they maybe have a stereotype, they haven't had personal success with it. And so that's why it's important to have you on, and we can rap about the ins and outs and what have you, is of how it works, why you do what you do. And kind of to your point before, is the body's innate wisdom to restore itself, that you help get it back on that path.
Right. Sure. Pretty much all the above. Everything that you mentioned has always been really an obstacle of, why people didn't understand chiropractic and how chiropractors can help people become healthier and ultimately be able to have an increased quality of life. And not only did people not believe it, they had to have resistance from a lot of the medical world, because the medical world was always putting it down and saying, oh, we're not real doctors, we're not this, we're not that. Meanwhile, we go to school just as long as the medical doctor does.
Well, to be fair, they put down all kinds of fields, not just yours. I mean, I remember DOs were sort of, the quacks of medicine. And, it's funny looking back now, DOs in a lot of cases do everything and anything that the MDs and allopathic training does, but they just do it better a lot of times because they consider, I think a lot of kinesiology along and manipulation and kind of the non-bread and butter allopathic dry stuff that the MD.
They're more open-minded. They're more open-minded instead of just close with, hey, there's a problem, give it something to mask it. Hey, let's identify the cause and work towards correcting it. And that's where myself as a chiropractor love, the knowledge that I've gained doing this for 20 plus years, and all the thousands of patients I've been able to help with getting them to understand the value of having a body that could work better through understanding, the things that we could help them to learn. And ultimately,
Mark was saying before that there are a lot of myths about chiropractic. Can you kind of summarize in a way that our viewers, could understand? What is it that you do that helps people? What is your model for how people heal?
Well, first of all, the power that made the body heals the body. We're all born with the ability for our bodies to function at 100%. But through different stressors that we become exposed to, all those stressors, they continue to build and build. And then the body finally can't handle that and can't compensate for it. And eventually our bodies become broken down. And what I'm able to do with is be able to first identify that, and then and through subjectively sitting down and just listening to a patient. I want to hear their issues. I want to hear what these things are doing to take away from their quality of life. I want to be able to be able to communicate back with them and in an empathetic way, so that they understand that I actually do care to not just get them feeling better, but then to increase their quality of life, because that's what it takes. It's not just about, okay, I'm going to throw a force in the spine, you're going to be quote unquote cured. I don't cure anything. Doctors don't cure anything. Medical doctors, a lot of them write scripts. Surgeons do surgery. I correct dysfunction that goes on with the body, allowing the body now to express itself. And ultimately, and I repeat myself because people don't understand that. They just think, hey, there's a problem, I need a pill. There's a problem, I need this to mask it. That's not what health is.
Yeah.
Health is about how resilient our body is. Our bodies are healthy by how resilient we are. If we come in contact with a stress and our bodies can put up that force field and fight against it, that means our bodies are working optimally and we stay healthy. If not, hey, we come in contact with something and we get broken down by it. That's not health.
Yeah, and there's this idea of healing that, something's off, if you're even aware something's off. If your body's complaining to you in some, way, shape, or form, there's an intervention, and the intervention is always some outside thing or additional thing, or like you said, a drug or a surgery or an implant. And if you think about it, almost all of the treatments and the interventions that we're used to in the Western world are improving on the design Mother Nature gave us. And I think that's where, what we all do is very unique and identical, and that the goal is not to provide an additional intervention. It's to restore the original functioning, treating the cause instead of the symptom. And in turn, empowering the patients, educating. That's the thing I like the most about you, is the educating of the patients, treating them like a person and not a disease. And I think that's why you get the results that you do above and beyond, as you really connect with patients on that level. And the mind-body connection. When you shift the mechanical, you're shifting the emotional, and that they're intimately linked. And even a lot of chiropractors, I think, miss that piece.
Yeah, my experience with a lot of chiropractors that I've known is that they use the term pop and pray. Okay, that to me is ridiculous.
It is
You're
ridiculous.
working with the spine, so you're working with really the whole craniosacral system, the central nervous system. What kinds of things do you actually do? What's the, I mean, literally, I think, you know, as a person who didn't go to chiropractic school and didn't go to medical school, I'm interested in personality dynamics and, you know, child development and all that stuff. And so I don't understand personally how you do these manipulations. What is it that you actually do?
Well, what people don't realize is our brains, they communicate to every part of your body through what? Your spinal cord, okay? Your spinal cord, that is your nervous system. It controls and coordinates every single function in our bodies from head to toe. And our spinal columns, they become stressed. They become stressed because we could sleep wrong. We could be a little overweight. We could have an old sports injury. We could have a whiplash trauma from 15 years ago. And eventually what happens is that body breaks down. It can't compensate for it anymore. So that's where I come into play. I have to reassure somebody that through the assessment, by first and foremost, x-rays are mostly necessary besides really an infant or a toddler, unless they want tumbling down the stairs. I want to see, hey, I'm working with your spine that controls every function. And if there is something that has translated right or left in comparison to normal, sure, I can feel something, but I want to know to the millimeter, to the percentage of obscurity from normal that we could go in there and change that and get it back to normal so the body can what? Now work the way it's designed to work. But that's through the assessment. That's through x-ray. And then when we analyze those x-rays, I can now have a tool in which when a patient sits down, they could see what I'm talking about. I could show them normal and I could show them, okay? And then we talk about this is what we need to do in order to re-educate your body to getting you closer to textbook normal. And if we don't work towards getting textbook normal, we can't get them well. But if I don't have those tools of analyzing x-rays, listening to a patient, and then sitting down and assessing it, it's just, I don't want to guess. I don't want to pop and pray. I want to be specific in what I do. And the more specific I am, the better results we're all going to get, okay? Ultimately, we get wellness. We get healthy. We become resilient. And that's what chiropractic is about.
And it's important to get to you sooner rather than later. Like, I think the stereotype is you wait until you fall off a building. You know, after my car accident, you were the first place I went and the first person I called. So you I'm sure typically see people who with very advanced disease very late, and so you deal with really difficult cases.
Oh, right? Absolutely.
If people understand that, hey, there's normal wear and tear, or you know, we were talking before the show about the COVID and stress being inevitable in life, but it being advanced right now. You know, like Rich likes to say, if you're selling stress, we're all stocked up, and that translates to our body. We store that in our body, and then you're, you know, turning the light back on, restoring the original state. And I think a lot of people don't realize how off kilter and out of whack their bodies are before you even start to get the first real complaint out of it. It's
absolutely
amazing.
Absolutely. Symptoms are pretty much always the last things to show up. Our bodies do everything in order to, you know, block the symptoms, you know, releasing endorphins and Kaplans, block pain receptor sites. But eventually the body gets worn down and can't do that anymore. And then all of a sudden, boom, we wake up and all we do is bend our entire shoe. Oh, can't get up, or you're putting a shirt on, someone's shoulder gets stuck or their arm gets stuck in an extension. It's not because they were weak enough or too weak to put their shirt on. It's because over time, that biomechanical instability, eventually the body says, hey, we can't compensate, and we go about our just daily task, and bam, all of a sudden that becomes like the end of the world when, hey, all we do is bend our entire shoe. Something we should be able to do until, you know, until we're 100 years old. It's a matter of people wait too long. The quicker we get to it, the better opportunity and the quicker opportunity our body is to get into the healing mode.
Have you noticed any difference in the level of symptomatology that you're dealing with? I know that Mark and I have talked about, since COVID started, the depth and breadth of symptomatology has gone off the charts. Have you noticed anything like that in your practice?
I have. I've noticed, just because of the lack of physical I wouldn't say mobility, but people just doing things they normally do. If it's, going just to the mall to walk around, to being social, going out to restaurants, people just aren't happy because they're not able to do the things that keep them happy per se. And that now is internal stress that keeps getting stored and stored. And now that mental stress is going to turn to physical stress because the body has that emotional breakdown. And now I want to say depression, but unhappiness. And unhappiness leads to a lot of dysfunction in the body. And that's why when it comes to the emotional aspect of it, I want to hear that. We want to set goals. I want to get your body feeling better, but I want to get it working better. And that's by being able to get the body to express itself, ultimately the way it's designed to express itself. And that's, without the stressors, the physical, the chemical, and the emotional stuff that goes on.
Well, the body definitely keeps score, but like you said, when you enlist that understanding, that education to that patient, I mean, you always spend extra time, and I think in any field, anyone appreciates that. And it's no secret that when people feel an empathy, when they feel entrusted, when they feel understanding and why you're doing and your philosophy, they open up and
Sure.
They're more open to receive whatever treatment, whether that's a physical manipulation or looking at some deep trauma that you've been repressing. And so that's the magic in what you do that I think makes you unique from any chiropractor I've ever known.
Thank you.
The studies on psychotherapy, I think, apply here. People like therapists who can do two things. Accurate empathy, can I accurately identify how you're feeling? And congruence, am I who I say I am? I think Jeff does that. Yeah, I would agree.
Thank you. I try to practice what I preach as much and as full as to my ability, because that's how you know that you can make that change. And if I wasn't a believer in what I did, I wouldn't be good at what I do. And I feel like I'm not trying to pat myself on the back, but hey, I change people's lives with my knowledge and with my hands, okay? In comparison to, other treatments that require, a lot more invasiveness, which is known to be just temporary or just a quote unquote quick fix. And sure, I want someone to feel better immediately, but ultimately, how long somebody's been dealing with it, yes, they might feel better, but it's not about instant gratification. No one's quote unquote cured. We're in the road to recovery, to getting the body to understand that it can function the way it used to function. But that takes some time, but that time has to come with also an education so that people understand the value that we have in, education of what is good and what is bad for the body. And hey, you make the decision for yourself. I can't make anybody do anything, but I sure will go blue in the face to get somebody to understand why and how I do it. That's for sure.
But there's a misconception that, if you feel better, you're healthy. And or the lack of symptoms, equates with health. It doesn't.
Right.
It makes me think of Parkinson's disease. A human doesn't show any signs or symptoms of Parkinson's until 90% of the nigrostriatal cells that are dying off in the disease are gone. So you're down to a 10% reserve before you even feel anything. And I think about physiology and chiropractics similarly, is that the body does a tremendous amount to adapt, to correct, to protect, to try to restore the original functioning. But when it can't, when it gets stuck, you have to have to get at the healing, to get at the original problem, you have to have what you do. You have to.
Absolutely.
You can't achieve those means through talk therapy or drugs. Or, and I'm not trying to bash every other field of medicine, although I'm quite comfortable doing that. But we talked about a badge of courage, I've got 2 plates and 6 screws in my back. Well, I'm sorry. That's the lesser of 2 evils, in my opinion, because the body's innate wisdom didn't include our geniuses coming in there and bolting things to it to try to increase structure. So, I mean, talk about that a little bit, about how someone can feel healthy, but still you can detect a lot of disease in their body and still have a lot of work to do so that the end goal is that you get people to come see you sooner, not like when I tend to come see you, like, hey, you know, Jeff, my leg fell off. Could you put that back on, please?
Yeah, I mean, yeah, like you said, the misconception that just because we feel good means we're healthy. No, feeling good is definitely part of, being happy and feeling good. Yes, we're going to get a lot of stuff done as far as quality of life, but also feeling good and not preventing ourselves from maybe not feeling good requires some external processes to go on. And that's where, when it comes to me, say you came in as a patient, your wife you didn't know anything about it, but she doesn't have back problems or headaches or, this or that. The bottom line is, hey, you brush your teeth every day, right? Because why? You're trying to prevent yourself from developing cavities. I check people's spines to prevent them from ever or possibly ever having, low back dysfunction or cervical dysfunction, so that doesn't develop into headaches or radiculopathy or decreased quality sleep, and so many different dysfunctions. Because of why? Because of spinal cord stress. And so yes, because we're feeling good, yes, it means we're healthy, but it doesn't mean we're firing on all cylinders. It means our body's working well, but getting checked is very important as far as to prevent dysfunction from settling in. Absolutely.
I mean, if someone has a lot of emotional stress, they ought to be thinking about going to you sooner, is my point. Because if you connect A to B to C, the stress that everyone's under, whether that's life, COVID, unique stressors, they translate to the body. They're going to come out. It's not a question of if, but when. And
exactly.
So if people fundamentally understand the pathophysiology of disease of this nature, they are empowered and aware and, more importantly, willing to come see you sooner to get them back on track. And how much easier is it for you with that patient as opposed to, a moron like me who comes when, his legs are dragging and, I'm still bleeding out the head. Hey, could you have me fixed? I have a meeting in 5 minutes, kind of thing.
It's really about above, down, inside out. Okay, that's how we express ourselves. It's not from outside in, and unfortunately, like we mentioned, in other medical professions, it's all about, hey, what can we take from the outside, put it on the inside in order to feel better. Okay, that's not getting the body healing any which way. Okay, unless we go into the, talk about different types of, adaptogens and what the body needs in order for it to, to break down some of the other chemical stressors that are, put into, GMOs, all that stuff, which will be on for another subject at a later time. But, it's ultimately our bodies need specific things in order to fire, and also specifically rest too. If our bodies don't get rest, our bodies can't really heal either. So the more unrest that we have, or just beating ourselves up, we're a ticking time bomb. And then all of a sudden it goes off, and then all of a sudden people think, okay, we need some quote unquote cure. Well, it's not that easy. It takes some time and takes patience in order to reset and undo eventually when the symptoms get there. Like I mentioned before, symptoms are always the last things to show up unless you have some type of traumatic experience. And sure, they might be the first things to dissipate and go away, but does that mean we're healed or cured? No, it just means that our bodies are now expressing itself a little bit better than they were prior to that. Now it's about pounding it down. Now let's get the body so every day, or now 2 days, 3 days, 4 days, now all of a sudden we're feeling better because our bodies are working better. And then it's about maintenance. It's about preventative. Let's get your body stable. Let's get you doing all the goals that we set so you could continue to enjoy life and be happy and function at the level that you want to function at. And now it's about, okay, let's see you once a month. Let's make sure that all that stuff that we do in between is able to now prevent it from coming back. And that's when it comes into the preventative state, which ultimately, hey, if I get you healthy, that you could do all your stuff, that's why you're coming in here. But if we can prevent it from coming back, that's what keeps me happy. It's the patient understanding the value of having a healthy body.
Oh, I want to talk about safety here for a second, because one of my fears at some point when I was starting to warm up to chiropractic was Is it safe? How do you know it's safe? I'm sure you're aware of, people have read cases, and I know there are extreme, obscure ones of a chiropractor either paralyzing or killing someone by, dissecting their carotids or something like that. Well, what is it that goes wrong? Is that a problem that we can blame on the patient? Like, well, your neck was too weak, or is it a problem with the training of that particular practitioner?
I mean,
what happens there?
If there have ever been any isolated cases in which they tried to blame chiropractic manipulations on some type of quote unquote a paralyzation or some type of stroke, I would say there's no possible way. The body had to have some other predisposed, pre-existing condition in which maybe the chiropractor did not dig deep enough in their chart or whatnot, or in their history that, hey, this person has carotid artery insufficiency. They didn't do specific orthopedic tests, which would set an alert of, hey, maybe you shouldn't do this technique and only do that technique. But that's where our training comes into play, so that we avoid any type of, that kind of stuff happening. And there are, I don't know, 10 million spinal adjustments worldwide performed a week. Okay, and we've heard maybe 1-2 cases in the last 25 years of somebody becoming, injured from a specific chiropractic adjustment. And if you dug deeper, it would be because the chiropractor did not dig deep enough in order to analyze the condition. And that's where x-rays come into play. That's where listening to a patient comes into play. You don't just lay somebody down and jam a force into somebody's spine, okay, considering the spine controls every single function in the body without analyzing it to the T, to the millimeter. And that's what we're able to do, and use the tools that are out there. Some people are lazy. Some people don't want to use those tools. Some people feel like it's not necessary, which is, it's just bad.
So the safety is clearly established. It's not something that you worry about, and I certainly don't.
No,
I want to reward the viewers that have made it 20 minutes into the podcast, so that we can show them just how safe manipulation is. See, because if I go like this here and I do a nice gentle,
yeah, see, that's a manipulation. That's not a specific spinal adjustment.
He's just being a joker today.
I know. He must be feeling good.
Yeah, I think
we must have undimmed his lights, right? Okay, over there, buddy. See that?
See the light. I see it.
See, what you did was a spinal manipulation, not a specific adjustment. What I do is an adjustment. I'm contacting specific dysfunctional joints and getting them working better. You're sitting there manipulating the heck out of yourself, and sure, bad things are going to happen. It's not specific.
This the afterlife?
That is the afterlife. I hope it's not, actually. I don't want to see that.
Sorry, that was just for anyone still watching. That was fun. That was for them.
So yeah, so to go back on the safety that you brought up, look at my medical malpractice. I have $2 million, $4 million coverage.
Hey, don't announce that.
$3,000 a year. That's because we don't injure people, okay? Medical malpractice, $8,000, $10,000 a month. Why? Because what's the number one killer in the United States?
Doctors.
Prescription drugs. No, just prescription drugs. That's from the statins, that's from blood pressure, that's from this. It's not just the whole opioid crisis. It's prescription drugs. Number one killer. Look at the United States. We make up 5% of the overall population in the world, but we've taken 75 to 80% of worldwide medications. We're 40th in the world in healthcare. I mean, is that telling you that kind of the system's a little broken? That we're not about preventing disease and dysfunction. We're about treating disease and dysfunction.
We also use 90% of prescription painkillers.
Yeah, exactly.
And we're still in pain.
But insurance world is going to pay for this. Like, instead of paying for something in which we could scientifically prove that we're going to get the body working and keep it healthier, they're going to let somebody take 400 pills a month. And
All
they
right,
think that's
all right.
okay.
Settle down. We've
No, it's
ripped your
ridiculous.
cord, and we're getting you off on a tyrant about why the Western
It's a
model
busted
sucks.
system.
Well, that's why we're actually doing this.
Who should I blame that on? Who should I blame? I won't blame it on anybody. Obama. I mean, nobody. I mean, just kidding.
Blame it on other kids.
Okay.
We've been working for many decades to this moment, and I think a lot of people are waking up that just taking a pill is not enough, or it's really can be counter therapeutic.
Why
And
we
that's
do
why
this
we're
show.
doing the show is to highlight, other. That's why it's alternative psychiatry. That
Right.
highlight other ways of thinking about it, because we've both been trained conventionally, Mark and I, and
Yeah, and look at
it
where it
isn't
got
enough.
us.
I want results. I don't want to do what everybody does. I want results. I want
Right.
people to have meaning in their lives. You
Mhm.
talk about more than symptom relief here. That's what it's all about for lasting change.
And I hope that, Rich, will that stick? I hope that sticks when we get through whatever, apocalyptic times that we're in, that this is going to be a one-way door, and people will awaken to, the incredulity of the model that we operate under for treating disease. And hopefully we never kind of go back there, just like, the 1950s or something. And people are turned on to total body wellness and health, and intervening for the cause, not the symptom.
Right.
Well, it seems to me that we have to be careful. And what I mean by that is, if you're a conventional person, somebody doesn't like you, they tell 10 people. If you're doing something different, somebody doesn't like you, they tell 1,000 people. But the reverse is also true. I wind up with cases that have been to 5, 8, 12 other therapists. And if we can get those people better, the greatest compliment happens that they refer their family and friends.
Absolutely.
I think the fact that Mark just wanted to have you on the show when he's gone to you for treatment speaks volumes.
Yeah. And why it's so important that we raise the awareness of everything that all of us are doing, because it's so not the old model. And the old model has got us into this mess.
Absolutely. And it seems like the model continues to keep becoming more obscured because of, the politics that are behind it.
Well,
Yeah.
it's just not working, that we hear all kinds of things, we see all kinds of things on TV. I think the one goodness that's coming out of the COVID thing is some people are really waking up that our conventional Western model hasn't done squat with this. In fact, it's gotten us in deeper trouble in other areas. And we could debate the politics if we want, but the medicine is not working. The censorship of certain approaches because of big tech or the insurance companies or the medical mafia, whatever the hell it's the same stuff that they would say about chiropractors. They say about any kind of alternative treatment. When acupuncture came to the United States, it was all mumbo jumbo. The fact that chiropractic and osteopathy, where it got its origins from, hundreds of years. This is not new stuff.
Right.
So, I think it's a good idea that people get to know about it. And on that note, I have a patient at 2:00. I don't know if you want to keep going.
I know. No, let's wrap up just by saying that, the title Manipulation for the Mind, this is what we've been talking about this whole time, is that, mind, body, health can come from a place like a chiropractor, even when you don't necessarily show terminal signs, symptoms of disease, and that it's an important part of our overall health. I know you get that. I want our viewers to get that. And I want to thank you for coming on here, because you're the best damn chiropractor I've ever known.
Thanks, man. I appreciate that, Doc. It means a lot coming from somebody who really was, I don't want to say closed-minded, but hey, it was drilled into your head that we don't make a difference and that we are quacks. And there's no better compliment than me being, asked to be, on your show in order to just be able to communicate what I communicate to.
See, I validated your profession in front of millions of people who might watch
I
this.
appreciate that. I look forward to the next time I'm invited back on your show.
Well, we hope to have you back, and maybe we can finish up that conversation about the politics or world hunger.
I would love that, actually.
But until then, you can find him at Advanced Chiropractic and Physiotherapy online, Dr. Jeff Kaplan. Oh,
thank you.
Rich, we were going to do that thing. Remember? Be well.
Be well. All right.
I am
Fair enough.
Go right, Lightning. Go Bolts. Let's go Stanley Cup.
That's it. Until next time, docs. That's it.
Thank you.
You're welcome.
Bye-bye, everybody.